Dear friends, 2 years of COVID infection, quarantine, and this pandemic situation changed a lot in life of many people and healthcare system of many countries. And it's not already something new that doctors start doing online consultations, and many patients had to stay at home instead of going to the clinics or hospital. If you're interested in telehealth and you would like to know more about using this distant consultation or even distant procedures, watch this video, and I'm Dr. Olena Berezovska. I'm welcoming you at my YouTube channel. When I talked to my colleagues, doctors, I found that the majority of them were very upset about online consultation. Probably 90% couldn't do it because it's not just you have to stay 30 minutes in front of camera or on a phone, listen to patients' complaints, but also advise something, recommend something, even prescribe medications. And it's not easy because many doctors get used to see the patient 5-7 minutes quickly, and to spend half an hour in conversations and advices and recommendations, it's not easy. And in many cases, doctors are very short and they're very uncomfortable to sit in front of the camera and talk to the patients through Zoom, Skype, or WhatsApp, Viber, and other network communicating system. First, let's talk what kind of doctor you prefer. And I'm sure that many of you like this fiction character, Dr. House. Why do you like Dr. House? He could be sometimes very rude, aggressive, abusive, and not very good to his colleagues. But at the same time, people ready to forgive all these negative sides of this character because Dr. House is very good in making diagnosis and saving people's life. People would like to see in a doctor, first of all, a very good specialist, a person who understands people's needs and knows the problem and know how to fix this problem. But let's talk a little bit about diagnosis. What is a diagnosis? To make a diagnosis, it's not enough just look at the patient or read the lab test. The very important part is complaints. And we don't need to know all about weather, about job, about relationship, but we need to know complaints about health condition, about disease. And also we need to learn the history. We call it anamnesis. It's a history of this disease or the problem, history of diseases in the past, sometimes family history. Because knowing only that, like complaints and a history, we can suggest a proper diagnosis in 90% of cases. After collecting the complaints and history, we need to do a physical exam, but not always it's not necessary because in many specialties the physical exam of the patient is not so important. But at the same time we can predict, we can suggest some diagnosis, and that's why we recommend to do some lab tests and some other procedures to confirm or exclude the list of diagnoses we have in our mind, and then get the final diagnosis. And if we have a final diagnosis, then we can prescribe medication, we can treat the patient properly. As I said quite often, this is the first part, collecting complaints and a history, plays much bigger role than even lab tests. And usually we use a gold standard diagnostic methods. It means it's methods that actually have a very high level of sensitivity and specificity. So it can give us very narrow window to make a proper diagnosis. And that's why online consultation, it's not so bad if the doctor follows some steps and decides when we have to send the patient to the lab or some other procedures, or we can prescribe medication even without lab tests in like other procedures. Healthcare in a home-based settings has a very long history, and the name telehealth, it means health at a distance. Tele comes from Greek word at a distance. So telehealth was many years ago, even before we had television or internet. In 1879, the Lancet article talked about using the telephone to manage the patient, to avoid unnecessary office visits. So you can imagine that it was 150 years ago when doctors started using phones to talk to the patient. In 1925, the cover of Science and Invention magazine showed the doctor talking to the patient on a radio. But you wouldn't believe that the telehealth we have now, it's thanks to programs created for astronauts. Mercury space program, when the National Aeronautics and Space Administration, NASA, began performing a physiologic monitoring for over the distance. And also there was created special program for people who live in rural areas of North America. And that's why we had this space technology applied to rural Papago Advanced Healthcare Project, very known project in North America. Telemedicine has also been used for decades in clinical settings. And for example, in 1906, the inventor of the electrocardiogram published a paper on the telecardiogram. Doctors could send this electrocardiogram through the radio. Since 1920s, the radio has been used to give medical advice to clinics on ships, because not all ships had a very good medical care. And Alaska actually had been the first model for the development and use of the telemedicine for decades. Telehealth also was used in clinical settings in hospitals, and one of the earliest, the most famous uses of hospital-based telemedicine was in the late 1950s and early 1960s. And a closed circuit television link was established between the Nebraska Psychiatric Institute and Norfolk State Hospital for psychiatric consultation. Also, we had teleradiology, and it has been used for more than 60 years. And radiologists have promoted the digital imaging and communications in medicine standards for transmitting and sharing and storing the data. We have quite a big history of using telemedicine for telepathology, when doctors, pathologists could share images too and have experience in learning new images and also discussing some complicated cases. We have also telepharmacology or pharmacy, because pharmacy has been prescribed over distance the medication for a long time. It saves a lot of visits to the pharmacy, and it's also used in obstetric and gynecology quite often. I remember the case when actually intrauterine transfusion, it means transfusion to the fetus, was done at a distance, when two best specialists of Mount Sinai Hospital were sitting in front of computer looking through the image of ultrasound, like a live ultrasound, and they were given advices to the doctor on Caribbean island how to do the intrauterine transfusion with less harm to fetus and to the mother. And the transfusion was successful, and the baby was born healthy. And this is 2.5 hours in this office actually gave me a lot of thoughts about the future of medicine, when we can help people even with surgical procedures, even with invasive procedures, thanks to the telecommunications. We have in Canada telehealth program in obstetrics for many years. I would say at least for 15 years or maybe even more. And actually the COVID pandemic showed us that telehealth is working, and we have new publication because many pregnant women had to stay at home, and we found that outcome of this pregnancy is even better comparing to the outcome of pregnancies where women were going to the clinic quite often, like regularly. The explanation is simple. The pregnant woman, when the pregnancy is healthy, had less stress, and that's why they could carry the pregnancy without complication to the term. Researchers from Oregon Health and Science University reviewed 28 randomized clinical and 14 observational studies that included more than 44,000 women. The goal was to determine the effectiveness and any harm of telehealth strategies for maternal health care. And they found that actually the result was much better. It helped to treat postpartum depression or to monitor diabetes or high blood pressure during pregnancy. They also served as an alternative to general maternity care for low-risk pregnancy. And these findings were published on July 25th in Annals of Internal Medicine. And we're talking about the condition that requires emergency situation because it's a acute condition. Of course, we cannot wait for online consultation. The patient has to go to the hospital. But when the condition of the patient is stable and actually, we have complaints, sometimes this chronic, for example, condition, it could be treated online through the telehealth, which now they try to implement because we have shortage of doctors, we have shortage of nurses, and also we have to deal with the situation. Severe pain, fever, high blood pressure, high sugar level requires immediate intervention. That's why if you have something like that, you have to go to emergency, call 911. I will talk about telehealth strategies in some other videos. But also when I'm doing this video and audio podcast for you, I'm actually using the telecommunications, which is really good, because we shouldn't push away the telehealth and say, no, it's something modern and scary. We should be reasonable and see pluses and also minuses and find something suitable for every patient. If you like this video, please press like, subscribe to my channel, and I see you in the next video. Bye!